last 30 years, the doctors were able to develop different test methods which are helping the mothers to identify genetically altered babies already in the womb before the delivery. And one of the first tests were available was the alpha-fetoprotein, followed by the triple test, which was a combination of different hormones, and which gave the mother a risk assessment, how much the risk for the baby being affected by a genetic condition like Down syndrome. Later on, this test was further elaborated to the quad test. This is the quad test. There are 4 different parameters to be measured in the blood and to be assessed and evaluated. And of course, through the research from major researchers, we were able to develop the nuclear transfusioncy, which was mainly developed in the UK. A combination of the blood test with the nuclear transfusioncy made us able to identify up to 90% of the individuals which are genetically affected, like Down syndrome.
So we do a screening with ultrasound. We do an ultrasound and we also do blood testing. In an ultrasound, the main area where you check for is the back of the neck of the fetus. And this is called knuckle translucency. You're checking for knuckle translucency because fluid collects, or large amount of fluid collects at the back of the neck in children with Down syndrome. So knuckle translucency is one of them. The other thing is a flattened nose or flattened nasal bone. So these are some of the areas which you check for in ultrasound, the Down syndrome. Right? And again, you can even check for the heart, like the congenital heart formations, malformations with the ultrasound.
When screening tests predict a high risk of Down syndrome, a more invasive diagnostic test is needed to confirm, can often be suspected based on the child's physical appearance at birth.
Now, when we go into blood testing, there is something called the PAPA. What is PAPA? PAPA is pregnancy-associated plasma protein A, and the level of this protein goes up in developmental abnormalities. The other important protein which is checked for is HCG, human chorionic gonadotropin. Now, if the level of these 2 proteins are high, then the doctor might ask you to go in for what is called an amniocentesis. Now, what is amniocentesis? Amniocentesis is otherwise called a fetal fluid test. A fetal fluid test. What they do is they actually, a fine needle is passed through the abdomen and passed through the uterus into the fetal sac, and they take out the fetal fluid, the amniotic fluid, and it is tested for chromosome abnormalities or for any fetal infections. It can also be used to determine, it is a most specific test for determining the sex of the baby. Now, the problem with amniocentesis is there is always a risk of miscarriage. It's always 1 out of 200 or 1 out of 400. A risk of miscarriage, which is why it is used with caution, and it is used only when there is an indication either on ultrasound or in the blood test of high levels of HCG or high levels of PAPA or high levels of alpha-fetoprotein, which is again done in the 2nd trimester. And that's when you go for an amniocentesis. So what are the other confirmatory tests for Down syndrome? See, one of them called as the Villus Sampling, the chorionic Villus Sampling, known as the CVS, where cells are taken from the placenta and tested for chromosomal abnormalities. Now, if these 2 are not still very clear, then they go for the PUBS. PUBS is actually the material, it's taken from the umbilical cord and then again tested for chromosome abnormalities. So this is the prenatal diagnosis. Now, once the baby is born, how do you confirm? You do a physical examination and then you send the baby's blood for karyotyping. So you come out with either trisomy 21 or you see translocations. So again, you can confirm a Down syndrome.
Basically, in order to identify those parameters which might be related to Down syndrome development is clearly only the maternal age. And we have been always contacted by patients who ask if smoking or drinking alcohol would increase the risk for Down syndrome, which is clearly not the case. Of course, alcohol and smoking cigarettes are causing other problems for the fetuses, like brain problems, like growth restrictions, but basically they are not altering the genes and the chromosomes of the unborn. So, and of course, through the research, in order to identify the diagnosis, and very important was to see how could be the screening program implemented. And one of the major achievements was actually to convince the health service providers to have a mass screening in order to identify those genetically abnormal individuals. And by this kind of screening method over the years, it was crystallized that we knew that actually one of the major and the only major parameter related to Down syndrome is the maternal age. And what we see as a development in society is that because of the career, because of the development in the society, the women go to university, the fertile age is pushed back to a later stage in life, and hence because of those developments, we will see more frequent genetic disease like Down syndrome, which is clearly related to maternal age. And hence, if we look about our figures here in the United Arab Emirates, there are studies and publications which are showing clearly that by Emirati ladies, 1 in 300 women are going to have a Down syndrome baby.
The neuropsychiatric manifestations of Down syndrome can include autism spectrum disorders. So what are the major symptoms seen in these children? They will have a problem in reciprocal social interaction, in mingling with people, in understanding other people's emotions, in understanding other people's intentions or motives. They will also have a problem in communicating with people. Development in language is much slower. They can have very odd, bizarre kind of behaviors, repetitive, stereotype behaviors. So how do you treat this problem? They will need all the support system required in a classical autism spectrum disorder. They'll need the ABA therapist, the applied behavioral analysis, individualized therapies. They will require occupational therapy. What you see here, like occupational therapy, which includes sensory integration. Now, the advantage of occupational therapy is it improves your fine motor movements. It improves your cognitions, thinking, learning, attention span. So this is actually a very, very useful tool in the treatment of Down syndrome children. And I would advise, it is very important to start this very early in their development.
The Down syndrome individuals are distinguished through certain parameters. Down syndrome because it's an accumulation of different findings, so which is predominantly through the cognitive retardation and intellectual deficits. And this is the main factor which is actually bothering the parents. And this is in combination with lung disorders, kidney disorders, heart disorders. This is a complex of findings. That's why we talk about Down syndrome. A syndrome is a combination of different findings.
Raising a child with Down syndrome has both challenges and rewards. Remember to take time for yourself and ask for help when you need it. Talking to other parents who are raising children with Down syndrome can be a big help.
Down syndrome was first described by this brilliant neuropsychiatrist in the United Kingdom, whose name was John Langdon Down. He described Down syndrome and the characteristics of Down syndrome in 1866. It was almost 100 years later, in 1959, that French geneticist showed the trisomy 21 as the cause of Down syndrome. Now there's another corollary here. John Langdon Down called this syndrome as a Mongoloid or Mongolian. Now this, as the years advanced, by 1960s or 70s, this started becoming an embarrassment for the race called Mongolian or the Mongolian people. So the envoy or the delegate from Mongolia requested the United Nations and the WHO to change this terminology, and this became a major point of discussion all over the world among the experts. And it was decided that the word Mongoloid or Mongolian would be taken out in all textbooks and replaced with Down syndrome. Now, looking at it statistically, there are almost 20% of Down syndrome children who are working in the United States. Almost 40% of children with even mild forms of intellectual disability graduate. Now, I'm giving you so much positive information. The life expectancy of a Down syndrome child was 12 years in early 1900s. But now in developed nations, it's 50 to 60%. And many of them are able to lead much more fulfilling and productive lives, which gives them a sense of integrity, a sense of pride, a sense of personal productivity. Now, the secret over here is early intervention. The secret over here is early intervention by a multidisciplinary, a multi-speciality group of experts. So you need the health experts, you need pediatricians, you need neurologists, you need psychiatrists, neuropsychiatrists who might contribute to the neurological and the cardiac part of complications of Down syndrome. And then you need specialists like behavioral therapists, speech and language therapists, IEP or individual educational plans to improve the language skills, the speech skills, the social skills of children, especially with autistic features in the Down syndrome. There is a worldwide movement to impart psychoeducation to society as a whole, to the community, because increased community participation is very important for the development of the child or integration of a Down child into the society. Schools and school counselors form a major part of the development of the Down syndrome child, because inclusive education is a major part of the development of the child. Inclusive education.
One of the most frequent questions to the mothers is if there is a therapy to cure actually Down syndrome. Unfortunately, we cannot change the chromosomes in the cells of the body. What is available is, of course, adjuvant therapies. If the Down syndrome individual is suffering from a problem with the heart, there are certain operations are offered. If they have a problem with the kidneys, there are certain treatments offered to cure those problems. But basically, the main issue, which is the extra chromosome in all the cells, cannot be cured, and that is available. And I think at this stage we have to talk also about prevention, because the prevention is, as we have discussed, the older the mothers are, the higher is the prevalence of Down syndrome. So basically, now we know all the obligations and the commitments in life, so therefore not everybody can get pregnant at the age of 23. So hence, even at later stage in life, there are certain tests in place which is helping the mothers to at least identify those individuals having a higher risk, and doing a genetic testing to identify those risks before around 12 weeks of pregnancy. So therefore, it is very, very important that the expectant mother goes to a specialized center or doctors and making those tests in order to identify the genetic condition of the baby and to see how much the risk is for that particular person delivering a genetically affected individual.
Parents also may get a benefit of this counseling and guidance, because the child with Down syndrome, how to handle them with their life, day-to-day life challenges. All these can understand, or they can learn, parents can learn through these sessions.
So it is very, very important for the couples with an affected baby to know that basically the way is only through engagement with the society and opening the doors for those Down syndrome babies, to let them to interact with other babies at the same time, and then go out and let them to develop them completely. And this is a challenge for the parents, not to be ashamed of those individuals and to engage more. And this requires certain resources which might be not available in certain societies. In other societies, all the services are there for these affected individuals. Nevertheless, the first priority and the commitment should be from the parents and from the immediate family to promote the intellectual abilities of those individuals. And that is very important for everybody, in particular for those babies affected with Down syndrome.
You can help your child stay healthy by scheduling routine checkups. This will help to identify, manage, and monitor any diseases and health problems people with Down syndrome have a higher chance of developing.
We are able to, first of all, understand